Lately, I feel like my memory isn't as sharp as it used to be. I can't seem to remember people's names as easily. These are thoughts many people have had at some point, and they're phrases we hear quite often. In moments like this, many people say to themselves, "It's probably just part of getting older." But that assumption is not always a safe one. Dementia does not usually begin suddenly. In many cases, it starts slowly, with very small changes that are easy to overlook. In today's video, we'll calmly explain the difference between changes that can be brushed off and signs that should be checked more carefully. Key takeaway: dementia cannot be judged by memory alone. What matters is paying attention to the patterns of change that repeat in everyday life. Early signs that are easy to miss. 1. Repeating the same questions. People may ask the same question again, even after just hearing the answer. Unlike simple forgetfulness, if explanations don't seem to stick, it's worth taking a closer look. 2. Confusion with familiar tasks. Activities that were once routine, cooking, handling money, finding directions, may suddenly feel more difficult. Rather than assuming it was just one day, repeated confusion should not be ignored. 3. Difficulty continuing conversations. Words may not come easily. Sentences may trail off, or conversations may be avoided altogether. 4. Changes in personality or mood. Irritability may increase without clear reason, or motivation may drop noticeably compared to the past. 5. Trouble with time or place. Dates may be mixed up more often, or someone may feel disoriented even in familiar places. A few simple questions to reflect on. Take a moment to think about recent changes in your daily life. Have similar changes been happening repeatedly? Have you ever felt briefly confused in familiar places or situations? Do everyday tasks feel more confusing than they used to? Compared to the past, do you feel that something has changed? If even one of these feels familiar, it may be a good idea to speak with a medical professional. Normal aging versus signs that need attention. Occasional forgetfulness can happen to anyone. However, if daily life is being affected, family members notice changes first. The person experiencing them is not fully aware. Then it's important not to dismiss these signs as aging alone. Practical steps you can take now. Here are some simple actions that may help. Keep a brief record of daily routines and changes. Review sleep habits and any medications being taken. Share noticed changes with family or close friends. Consider whether these changes have lasted for weeks, not just days. These steps are not a form of treatment, but a way to prepare and better understand what's happening. Important cautions. Don't rely solely on information found online. Avoid unverified folk remedies or claims. Try not to repeat the thought, "Let's just wait and see," for too long. A common misunderstanding. Isn't it already too late if it's dementia? No, it isn't. The earlier changes are noticed and checked, the more options there are for responding and planning. What we often see in real life. In medical settings and public health resources, it's not uncommon for family members to notice changes first, leading to early evaluation and detection. Where this information comes from. This video is based on guidance commonly shared by national health organizations, medical association guidelines, and patient education materials from major hospitals. A note on limitations. Not everyone experiences these changes in the same way. That's why it's important not to make decisions alone. When to consider seeing a doctor. When symptoms worsen quickly, when daily activities become difficult, when family members clearly notice changes. In these situations, consider seeking medical advice. Even if you feel fine, your family's perspective may be different. This video may be helpful to watch together with parents or loved ones. Dementia is something we can better respond to when we notice it early and prepare. Understanding the facts can also reduce unnecessary fear. In our next video, we'll continue sharing reliable, verified health information. Disclaimer: this video is intended for general health information only, and does not replace professional medical diagnosis or treatment. If symptoms persist or worsen, please consult a qualified healthcare professional. Thank you for watching. If this helped you, please like and subscribe. Changes that are easy to dismiss as just aging. Dementia does not appear overnight. Don't judge by memory alone. Repeated changes should be checked. Often, family members notice first.